health services, not only in Ireland but internationally, are having increasing demands in relation to the provision of services to our patient populations. Ireland is leading the way by implementing this systematic research-based approach to determining staffing levels both of nurses and of healthcare assistants that provide direct patient care. So to date, we've done medical surgical settings and we've done emergency settings, and we're currently working in the long-term residential settings for older persons. So what we've done is, because of the complexity, there's a software system within the medical surgical settings, and this gives an overall picture of the complexity of patient need within it. We determined a model called nursing hours per patient day, and this determines the number of staff that are required based on patient acuity and patient dependency. We then tested this in a number of pilot sites, and it's now been run out nationally. The framework doesn't always lead to an increase in staffing levels. What it does is it identifies the correct staffing and the skill mix required in an area, but sometimes adjustments are needed in relation to staffing, and there's a cost associated with that. But what we've seen is that leads to a reduction in agency staffing. Reducing agency staffing not only has an economic impact, you're also leading to continuity within a clinical area, because you've got staff that know the area. We know the cost of an adverse event, the incidence of pressure sores or falls or hospital-acquired pneumonias in particular. They were reduced because patients would be mobilised quicker, patients were receiving their medications on time, and so on. That leads to better patient outcomes, it leads to reduced length of stay, and this also has an economic impact as well. Levels of retention and recruitment also increase. It's having an impact on staff because they are more likely to stay in an environment that has correct staffing, there's a good working environment. When we rolled out the model then into emergency departments, we saw that the number of patients who left without being seen reduced dramatically. We saw that the time from admission to triage and then triage to being seen by a key care provider also decreased. And we saw the overall ED care time decrease. So it's been implemented on a stage basis in all hospitals within Ireland, both medical, surgical and currently in emergency departments. At present, approximately 10% of the total workforce in Ireland work in health and social care, and this is going to increase up to 15% over the next 10 years to meet the demands within health service. But by having a model in place, we can ensure those needs are met, that the right staff are in the right place at the right time, providing care with the right skills.